Okay, everybody, we're going to pick up today, and this will be the last day of first aid, the first aid portion. Then we're going to do CPR, and you're going to watch some CPR videos. And it's going to instruct you on different types of CPR for adults, infants, and children, along with Heimlich maneuver for choking. But let's get started with poisonings, alcohol, and drugs. So poison is defined as a substance that will cause a reaction that damages tissues, alters organ function or systemic function, and can cause death. Poison can be lots of different things, and it can be something that you ingest. It can be something in the air. It can be something and that you come in contact with your skin as well. So just be sure that you are aware what a poison is. If it's swallowed, we want to hope that that's accidental, but sometimes poisons are ingested intentionally. Sometimes they are actually given to people intentionally as well. So just be sure to know that they can ingest it by poisoning. I'll give you guys an example. Many years ago, I worked in an emergency room where a mother put green antifreeze in a sippy cup for her child, and instead of a green juice that the baby was used to eating. Well, the thing is, with young children and old people, antifreeze tastes sweet. And so they literally thought they were getting something like Kool-Aid. The mom said it was accidental, but it ended up the mom went to prison for it. So just know sometimes things get ingested, not just accidentally. Sometimes people ingest things intentionally, or they're intentionally administered to someone. Sorry, inhaled poison. So those are things that we breathe in. One of the most common ones is carbon monoxide in our household, especially in households that have propane and gas heaters. Dearborn heaters have to be very careful to make sure that there's a proper ventilation so that the house circulation in the house works well. I know sometimes in the winter, people go hunting and they have little hunting cabins, or they have little campers that they hunt in. And instead of having the normal heat system, they'll have a little propane heater in the house, and those are in a little cabin or a little enclosed area. Those are very dangerous, and carbon monoxide can build up. There are also different kinds of gases that can be inhaled that are poisonous, but it must be administered into the air. Absorb poison. So poison ivy, poison oak, those are some of the things that we actually get from a specific plant. Also, sometimes due to different kinds of fertilization or other things, we can absorb small amounts of arsenic or other pesticides through the skin once they've been sprayed, which is why when someone's crop dusting, we don't need to be outside, because we could actually either inhale and or get those specific types of poisons onto the skin. Injected would be venomous through snake bites, through spider bites, any of those kind of things. Through recreational drug use, we can get poisons injected or overdoses of medications. So just know that, there was a young man that came into the emergency room to see me. He was in really bad shape, and he had been a heroin user. He had been shot in the leg, but he also was a heroin user. And he mixed mercury with his heroin because he said it made his buzz last longer. Well, mercury is very toxic, so it would be one of those things that definitely could cause a poisoned reaction. So if someone ingests poison, signs and symptoms might be nausea, vomiting, diarrhea, abdominal pain. They may throw up blood, or may have bloody diarrhea. They may have odor, a weird odor coming from their breath. They may have pale or damaged skin on the inside or outside of their mouth. We want to look for the container or whatever they took, and we want to call poison control. We also want to look and see if there's an antidote on the back. Sometimes there will be something, it'll tell you what to do on the back if someone has ingested a poison. whether to induce vomiting, administer milk, whatever. But the best thing you can do is call poison control if you know what they've ingested. We're going to call 911. We are going to, so this gives the information from Iowa Poison Control. I'm going to give you guys some information on poison control. This is not an editable PowerPoint for me. It's just one of the best ones I've ever seen. But we want to be sure that we follow the directions, whether it's administer Ipecac to induce vomiting, or we want to administer milk, whatever we need to do. We want to make sure that we manage ABCs. We call 911. We try to figure out how long it's been since they've ingested it, and then follow the directions of poison control. We don't want to induce vomiting if someone is unconscious, if they have seizures, if they're pregnant, if they have heart problems, or if what they ingested was a corrosive. So if someone drank bleach, we don't want to induce vomiting. So, but the back of most products will tell you do not induce vomiting, and poison control will tell you the same. But the best thing you can do if someone has come in contact with any poison is to contact poison control. They will tell you exactly what to do, how to do it. And lots of times, even when you call 911, 911 will actually put you on a call with 911 and poison control as well. Inhaled poisons, signs and symptoms of that: headache, dizziness, weakness, changes in vision, blurred vision, double vision. Sometimes they'll have a loss of vision. They'll have their throat and chest will feel tight. They'll have difficulty swallowing. You'll also have a wheezing sound. And inhaled poisons can lead to a full arrest, cardiac and respiratory arrest. So we want to be sure if someone has inhaled a poison that we also make ourselves aware that and try not to inhale that ourselves. It might be gas in the house. It might be carbon monoxide, something like that. We won't be able to see it. Sometimes there'll be an odor, but not always. If it's a natural gas or propane is leaking, you'll be able to smell that. Carbon monoxide you cannot smell. Lots of gaseous kind of poisons can't be smelled. What are we going to do? Once again, you have to protect yourself, or you can't help others. So we want to make sure we call 911. If we have oxygen available, we want to put them on 100% oxygen if it's possible. We want to get the patient out of the environment if we can do so safely, and manage that airway, breathing, circulation. If there is an inhaled poison, we do not treat that at all in the location where it's at. Okay, just be sure that you do not try to treat someone who has inhaled poison in the location that they are unconscious or that they have inhaled it. Remove them from the area if at all possible, and it's safe to you. You're going to see redness to the skin. So they're going to look really flushed, especially if it's carbon monoxide. They may have blisters or rashes. They may have swelling around the mouth and nose. They may have, if they're conscious, they may, this is absorbed poisons. I'm sorry. Swelling, itching in the air, around the area where they've come in contact with an absorbed poison. Did I go too far? Nope. Yeah, I did. I'm sorry. I skipped. And they're going to have some itching. If it's poison ivy or poison oak, you're going to see some blisters pop up. You're going to see red areas that are going to spread with scratching. So just be sure that you try to tell them not to scratch, not to touch anything that's draining or oozing, and that they get treatment. We want to, if they have an area that is absorbed or exposed to a poison on the skin, we want to wash it immediately with soap and water. Not strong pressure, just normal faucet water. Baking soda compresses to an affected area, or poison ivy, for poison ivy or poison oak 4 times a day will help with that. Also, hot baths relieve natural antihistamines, and they can help slow down the progression. If it spreads significantly, or if someone has swelling around the mouth, the nose, difficulty breathing, difficulty swallowing, if they have any kind of issue, you want to be sure that they seek medical attention. Also, if it continues to spread, then we want to go ahead and get them treatment. There's other kinds of steroid treatments and things that they can receive to help stop that process. Injected poison. Signs and symptoms would be obvious bee stings, where there's been a tick, a snake bite, puncture marks in the skin of any kind. If it is drug related, there'll be needle tracks, and those would be where basically you can tell that someone has injected something into a vein and they'll be bruising around it. They'll have localized pain and burning where there was a snake bite, a bug bite. A brown recluse spider actually has a part of their venom numbs the area, so they won't actually feel anything, but they'll kind of feel flu-like a little bit later. They may have nausea, vomiting, swelling, and redness to the area, or a bullseye-looking marking, tightness in the throat, difficulty breathing. If it is a snake bite, if it's a rattlesnake or a copperhead, that has to be treated. They need to go on into the emergency room because they're going to need maybe some anti-venom called Crofab, or just to monitor it to see how the swelling, to monitor to make sure that the venom is not spreading and causing other issues. Sorry. Treatment for injected poisons. So that would be manage ABCs, identify the poison. If it's a tick, you want to pull it off with a tweezer, but you want to make sure that the head also comes out. You do not want to leave the head in. Because ticks can have Lyme disease. Lyme disease has extensive and long-term effects. So if it could be a tick that had Lyme disease, or you start to have flu-like symptoms a day or two after a tick is removed, you want to go ahead and seek medical attention. And then if it is some kind of poisonous, like a snake bite that's poisonous, if it is something that someone's having an allergic reaction to, or a drug that someone has injected that is potentially harmful, we want to call 911 and we want to get them treated. Other things drug related. So there's going to be mood altering substances that we will talk about. And those are things that affect the way that our thought process, affect the way we respond to things. And in that manner, we want to be sure that if there have been mood altering substances or anything like that, we want to be sure that that's monitored. So alcohol is a depressant. Please remember that alcohol is a depressant. Even though it kind of makes people feel better and giggly and things at first, it depresses the physically and psychologically. It depresses your reaction time, your thought process, and also remember when they do when someone drinks, especially too much, it not only can make you go to jail, it can also, if you have a professional license and get in trouble for alcohol abuse or an issue of alcohol, having a blood alcohol limit that is above the legal limit, and you get in trouble, it can actually have your license revoked. Drugs, they can be stimulants or depressants. They can either speed up or slow down the body system. And know that when we talk about mood-altering substances, it's how it affects the nervous system, not necessarily specifically how it makes the person feel. Stimulants affect the central nervous system. They give you a feeling of well-being, increased energy. They can cause you to be real restless. One of the things that they do, some stimulants can actually cause people to be even aggressive, and they don't really realize that. Not only are they their emotions are hypersensitive, and they can cause them to be aggressive. Some things that are considered uppers that are frequently abused are caffeine, cocaine, amphetamines, anti-asthmatic drugs, because they kind of give you that same feeling as antihistamines and other vasoconstrictors. Those would any kind of anything that someone might use that would increase their speed up their mind. So people frequently abuse Adderall, ADHD meds that they take them and they don't need them, like Adderall, Ritalin. Those are medications that are also that are stimulants that are frequently abused. Depressants are things that slow down the central nervous system. They can cause drowsiness. They can relieve anxiety. They can relax the body. Things that are frequently abused that are depressants would be marijuana, barbiturates, which would be things like Valium, anti-anxiety meds like Xanax or Ativan, tranquilizers, other narcotics like hydrocodone, morphine, oxycodone, fentanyl. Those are all depressants, as well as anticonvulsants. And so people do frequently use those to slow down the body. Signs and symptoms: alcohol, we can generally smell that. They'll have coordination issues, drowsiness, slurred speech. Initially, hyperactivity, and then they can become even combative. Once someone has had an excessive amount to drink, it can cause nausea and vomiting because the liver can only process so much alcohol at one time before it can't produce it it can't break it down fast enough, and then it induces that nausea and vomiting. Also, it causes flushing. It causes vasodilation, which can make the face flushed. If we feel like there's been any kind of drug abuse of any kind of drug, whether it's a stimulant, a depressant, any kind of drug we feel like that may be abused, or alcohol, or overutilized, then we want to make sure that we're managing ABCs. We call 911. We look for signs of injury or shock due to the fact that they may be falling or in fights or having any kind of issue. We want to take them to the ER. If we think that they have overdosed on alcohol or drugs, we want to take them to the ER. We want to call 911 and get them something to help treat them. Know that it's likely that they may vomit, so we don't want to leave someone. We don't want to leave them laying on their back or on their stomach. We want to turn them on their side if they have passed out. We want to try to keep their head elevated if possible. That way they don't choke on their own vomit. And then make sure that we know what the person has overdosed on so that we can help 911. We can help the 911 operator. We can help the paramedics by letting them know what the person has had too much of. Did they overdose on amphetamines? Did they overdose on alcohol? Have they what have they taken? Okay, so we are going to stop there. That is it for this particular portion of 911. This particular portion of first aid, and then we're going to actually start watching some videos. You're going to have a quiz over 5, 6, and 7, which this is lecture 7, and then we'll start watching some videos on CPR. So if you guys have any questions, let me know, and I will be back with you later. Thanks, everybody.